Hi, this is Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our patient information series. Remember that these videos don't replace visits to your regular physician, so if you're having questions or if you're not sure what's going on, please make an appointment for your child to be seen. We want your child to get only the best possible care. We'll be happy to see you in our office, same day if necessary, area code 775-359-7111. Today, let's start by talking about tonsils and when to worry about them. There's a lot of stuff going around about what tonsils are and when to worry, most of which is not true. So we kind of want to demystify that. First, tonsils are immunologic tissue. They are they're the army bases where the army men that fight infections in your mouth and throat live. There are really three of them. There are two on the inside of your mouth at the very back of your throat, right at the base of your tongue, and one on the soft palate that you can't see way at the back of your throat. If you could reach around right below the thing that dangles down the uvula, if you reached around right on the other side of that would be that one. That's called an adenoid, but it's the same tissue. It's responsible for surveying things that you put in your mouth and finding out if it's infectious, and if so, mobilizing the immune system to kill it. So they swell up anytime you have a cold, allergies, infections in the head and neck, including the middle ears, including the throat, including the tongue. And to a point, they're supposed to be there. In infants, they're very hard to see. As the kids grow over the first year of life, they quickly reach the size of about a large marble. Okay, so roughly something that large on each side of the throat. There should be nothing on top of it. They should be nice and pink or reddish. Once in a while, food will get stuck in there when they're big, and that'll give it kind of a whitish hue. And it's can be kind of hard to an untrained eye to distinguish between that and pus. But white on there's not necessarily anything bad. When do we worry? Well, we really don't. Okay, tonsils are supposed to be there. They are supposed to get to be the size of a large marble, and food can get stuck in there, so they may be whitish. Exudate or pus on the tonsils per se is not necessarily a problem. That's a sign of a throat infection, but does not necessarily mean that it's a bacterial infection. Many viruses will give you red, ugly tonsils with lots of pus. So the mere fact that it's there is nothing to worry about. We worry about kids who have fever and sore throat without any other symptoms. And if that's happening, we want to see you and rule out strep. But if they're just big and ugly, per se, they're nothing to worry about. Often that's a virus. So when do we take them out? Well, we take them out if they're causing your child to have obstructed breathing at night, so-called sleep apnea. We take them out, and that doesn't matter how old your child is. If your child's having sleep apnea, the tonsils need to go. We take them out if you have recurrent infections. Roughly, it's 5 infections or more in 6 months, or 6 infections or more in a year. The guidelines on that have just changed a little bit, but without going into the details between the new and old guidelines, it's a lot of infections, okay? Or if you're having infection after infection after infection, even when we treat it, as soon as we stop the antibiotics, you rebound, and by infections we mean streptococcal infections. And these infections need to be documented with a rapid strep test, not just looking in and somebody going, oh gee, that could be strep, but actually either positive rapid strep or positive culture. And the reason we would take the tonsils out under those circumstances is if that keeps happening, that tells me that you have bacteria, streptococcal bacteria, living inside the tonsil in walled off areas, and we're not able to kill it with antibiotics, and that's not necessarily a good thing. Back in the day, meaning 30 years ago or more, most kids had their tonsils out, but in the modern world, most kids do not have to have their tonsils removed. Tonsillectomy is a large surgery with a lot of complications, including risk of dehydration and bleeding, so it's not something we take lightly. Tonsillectomy needs to be performed by only a skilled surgeon, skilled in ear, nose, and throat surgery in little people, and often requires overnight or even 2 or 3 days in the hospital. Usually it's just overnight, but often requires overnight in the hospital, so we try not to remove them. But definitely if your child is snoring like a freight train, that's an issue. Sleep apnea has its own concerns and is not in the child's best interest, so that's a reason to take them out. They are an important functioning part of the immune system, and as long as they're functioning normally, we want to leave them there. This is Dr. Kevin Windisch. I hope this has helped to demystify some of this for you. Again, if we can be of any assistance here in our office, give us a call at 359-7111. We'll see you next time.